Welcome to GB News Originals. I'm Lucy Johnston. This week, junior doctors have confirmed just about an hour ago they will be staging one of their longest walkouts yet. 5 full days of industrial action. And from Friday, they will be walking out over pay. But behind the headlines and these heated negotiations lies a quieter, graver cost. Cancer patients, hip replacements, cataract surgeries have all been postponed in previous strikes. Waiting lists are spiralling up to 7.4 million now, and patient deaths have now been directly linked to previous strikes. We're going to ask today, is the NHS on the brink? And joining me is Professor Karol Sikora, a leading cancer specialist, former director of the World Health Organization Cancer Programme, and one of the UK's most outspoken critics on cancer care and NHS reform. Welcome, Karol.
Thank you.
Today, we're going to ask, is the cost of this industrial action becoming too high? So we can start with the most shocking development. We've had these 5 deaths confirmed by coroners as being directly linked to the strikes. Professor Sikora, do you think this is part of a wider systemic failure in the NHS?
I think it is. Obviously, the strikes don't help. They add to the confusion of the situation. It's always difficult to know, would things have gone differently for these 5 patients if the doctors hadn't been on strike? But there's no doubt the strike on Friday will result in severe harm to some people who we just don't know. The real problem is the NHS is so disorganized at the moment. It's in silos, the health professionals, the nurses, the doctors, the senior doctors, the physiotherapists, the radiographers, all different professional groups, all with vested interests, not working together as a team. And, as one of the reviews nearly 50 years ago said, who is in charge? Nobody knows. The administrator, the manager, the chief executive of the hospital has the biggest office, but does he actually interfere in clinical care? The answer is no.
So let's go back to the strikes. You've been a vocal critic of junior doctor and consultant walkouts, but the BMA says that they're the last resort after years of pay erosion and unsafe staffing. So do you think they've got a point?
You look at it, doctors coming out of medical school, I was at the graduation ceremony at my university last week, full of enthusiasm, throw the hats in the air in the usual way, jumping in the air with excitement, proud families with them. And they're excited to be on the ward. They come there the first day as a staff member. Obviously, they've been on the ward before, but not as staff. And suddenly, it really hits them. It's drudgery, it's bureaucracy, papers, checklists, all the usual sort of things, and a sort of toxic environment in many places for them. And they grin and bear it. They don't feel loved or wanted necessarily to start with. And you have to adapt that it's perhaps being a doctor is not quite what you see on television, for example. And they adapt and then they gradually settle down. But I think whether the pay is less or not, any professional group can take a random year in the last 20 years and say we've had pay erosion. The doctors have done it for 2008, and they've selected 2008 because obviously the sums add up better for that year than any other year in the past. Is this fair? Probably not. I think the BMA has sort of really eroded it. So I stopped being a member about 20 years ago, and I'm surprised that they've gone to war now. I mean, they've said that it's unsafe to carry on doing things. Where doctors should charge, consultants like me should charge £300 an hour or over £300 an hour to cover junior doctors this weekend. I mean, that is really pushing. It's a war. You're setting out we're going to war with the system, which is not how it should be. I have sympathy with junior doctors, not so much their pay, but some of the training pathways really need to be smartened up to give them better choice and a faster throughput through their training, postgraduate training. But I think the money, it's not that bad compared to other professional groups, except investment bankers. If they want to be investment bankers, they can go and do it, I guess.
So you feel that it's more about the conditions and it's become an issue around pay. But given that they are disgruntled, you could argue, well, how else do they get the government to change things and listen? They've had endless negotiations. Why are you so against strike as a way of actually forcing the arm of government?
I think the strikes hurt patients, and they're not really the guilty party. They're not the one that's in dispute. And in the acute phase, it's going to hurt people going to an emergency room that need admission for an emergency. It's going to hurt people that have been on a waiting list, maybe for 18 months for a hip replacement. They're going to get a call on Thursday to tell them their operation on Friday has been cancelled. Whatever.
Well, the government has said that they don't want any operations cancelled, any planned surgery cancelled this time. So do you think that's going to work?
No, it won't work. I mean, junior doctors, there's 50,000 of them. It depends how many actually walk out, I guess. That's part of the problem, Lucy. We just don't know. And again, the BMA has been very unhelpful. They've told junior doctors not to tell anybody if they're walking out or not. So the management, have no idea what's going to happen. What would be the most unfair thing is for people booked for an operation to get a phone call that, get everything, got their dog looked after, all the things you have to do when you go into hospital, and to be phoned the night before to say sorry, or even on the morning, and this does happen, we all know it in the NHS, to say sorry, your operation's off. Having a hip replacement, I mean, it's not a major operation, but it's pretty upsetting in someone's life, especially for an elderly person. And I think that's just grossly unfair. They've paid their taxes, they expect to get a service. And I think, there are ways that junior doctors could get themselves heard without withdrawing their services, basically. And I think it's really upsetting.
Well, I could ask in a minute, how can they get themselves heard? Because they've obviously been saying this for a long time. But do you think we should have similar rules for junior doctors as we do for firemen, police, army, that there are actually huge restrictions on their ability to strike or they can't strike at all? Do you think we should bring that in?
If you're a US resident, let's face it, things feel uncertain right now. America's national debt, over $36 trillion and climbing. Inflation, still eating away at your savings. And the dollar, down nearly 8% this year, with more countries walking away from it. Meanwhile, the markets, one day they're up, the next day, trillions gone in a blink. So it's no surprise people are asking, where can I actually put my money and sleep at night? That's why more investors are turning to gold and silver. Gold's up over 24% this year, smashing records and soaring past $3,300 an ounce. And some analysts say we could see $6,000 gold before the end of Trump's term. And silver, it's heating up fast, driven by demand in tech, solar and defence. Some analysts say it could double in value this year. If you've been thinking about moving part of your IRA or 401k into gold or silver, tax and penalty free, our friends at Priority Gold make it simple. They're endorsed by Rich Dad's Robert Kiyosaki, ranked number 1 by Forbes and Financial Services Review, and trusted by thousands of everyday Americans. Right now, GB News viewers can get a free wealth preservation guide from Priority Gold. It shows you exactly how to add real gold and silver to your IRA or 401k tax and penalty free. Step-by-step plain English, no pressure, just smart information you can act on. Just scan the QR code, click the link in the description below, or if you're a US resident, text WEALTH to 24999. That's WEALTH to 24999 and claim your free guide today. The price of gold can go down as well as up. Past performance does not indicate future performance. Only invest what you can afford.
I think we should bring it in. I really do. And, my generation, I think we're pretty unanimous. I've been in the business 50 years and I've never striked and none of my colleagues have ever striked. It's a modern thing and it's just a societal breakdown, really, that doctors who a sort of one of the pillars of society in reality. You want to be able to trust the doctor, actually contemplate taking an action that could lead to harm. I mean, it's, the 5 deaths are very sad. I'm not convinced that they're really due to the strike. They're probably due to the way the NHS works and the undercapacity it has for dealing with the number of people that come through. But I do think it's wrong for doctors to strike. And I think if this happens, I think people will seriously look at changing the law to put them in the category of people that can't go on strike.
So you've warned repeatedly about the effect on cancer care, and I think we know that around 36,000 cancer appointments were cancelled since doctors first walked out in December 2022. Can you outline what you're seeing on the ground with cancer care? And of course, the BMA argues that emergency cover is maintained and disruptions no worse than during a winter crisis. But what are you seeing, and what's your response to that?
I think the problem with the NHS is operating beyond its capacity, and it uses delay as a way of rationing. And of course, you add junior doctor strike, that just increases the delay. I mean, as I said, you can get the best treatment in the world for cancer and heart disease and other things out of the NHS, but you can't get it promptly necessarily. I mean, sometimes patients I've seen just beat the system. You don't know how. They've just managed to get through the system in record time, and the next week they're on exactly the right treatment. This is rare, though. The target for cancer treatment is hopeless. It's 62 days from diagnosis to treatment. In Poland, my father was Polish, and I speak a little, I go there a bit. In Poland, it's 7 days. And even the 62-day target in the NHS is not being met in a third of all trusts. So, and that's 2 months. Cancer doesn't have a holiday for 2 months whilst you're waiting to treat it. It continues to grow, and growing cancer spreads, and more spread of cancer means more difficult to treat and poorer results. So, that's why we're bottom of the European pile in terms of outcomes for cancer. It's not that we haven't got the skill. It's just the whole pre-treatment phase is just hopelessly, laboriously slow. And the strike will just slow it, just like COVID did. The strike comes along and disrupts the whole pattern of hospital life. And that will lead to a delay. Operations delayed, diagnostic scans delayed, biopsies delayed, and so on. And treatment delayed because of that.
So you've described some of the pay demands as unrealistic. Junior doctors say that they've lost 25% in real terms. Do you think it's fair to ask for any restoration, especially given inflation and the workload?
Everybody could do that. I mean, you could say an accountant or a lawyer could say, well, I look back at my 2008 rates and it's gone up more than I'm being paid now. And that's the problem. Teachers, if you just take the public sector, including the professions we mentioned, firefighters, police, paramedics, and so on, everybody's in the same boat. The cost of living is difficult. The cost of housing is going through the roof. And in very short supply, taxation's going up, so the amount of money in your pocket is not what it used to be. And I think for one professional group to hold everybody else to ransom, and traditionally it's the train drivers that do this, and they go on strike and they get paid, and they go on, another year later they do it again. It's not usually doctors, so it's very sad to see that the doctors as a professional group are doing this.
Do you think the BMA has lost sight of patient interests? And do you think that they are sort of becoming, some people have accused them of becoming quite militant and quite introspective? Do you think that's what the public is asking? I know that the support for strikers has gone down from around half, 50% of the public, to around just over 20%, I think. So the public's, I think, losing support. But what do you think of the BMA in this?
The BMA
I'm
has
sure.
definitely lost its way. It's been taken over by extremists of a dangerous form and politicians. That's the problem. Healthcare is not a political business. It's a transaction. You pay money either for your tax or through your insurance, and you expect a service when you're ill, and it covers certain things. Exactly like travel insurance. You pay into travel insurance. You go on holiday. If you're ill, you get your healthcare paid for. The problem is it's been taken over by people that seem to be intent on destruction, even of a relatively left-wing government, which is amazing that it would happen here. If it was a right-wing government I could understand it more, but this is a left-wing government that believe in public services and taxation, and yet they're basically attacking that. And yesterday, I was absolutely horrified on the way they reacted to Sir James Mackey's statement not to cancel routine operations. They just almost blamed him for causing death. I mean, it's them that's causing the death if that happens, not Jim Mackey, by saying we've got to try to carry on as best as we can. Let's not cancel everything, which seems a reasonable stance. So it'll be interesting to see what actually happens and how many junior doctors actually walk out. There is a little clause in the whole thing that if the general managers say we're really running into a lot of difficulty, that junior doctors will come back. That if it's a life and death situation, they said they'd come back. And it was used very sparsely the last time. Will it be used this time? I just don't know.
I suppose it's not always easy to know that far ahead whether it's life or death, and it's the delayed cancer care, as you said, that's not immediate life or death, but you might miss a
Right.
cancer operation. And you've said before that a month delay in cancer treatment is a sort of 10% increased risk of dying from that cancer. Is that right?
Exactly.
Yeah.
And I think, the obvious road traffic accidents coming into the emergency room won't be affected. So people don't need to worry about that. But I think what will be affected, routine operations and cancer diagnosis operations, because you don't know you've got cancer until someone does some sort of surgery to take a piece of tissue to diagnose it. So these things may be put on hold or maybe slowed down. And it's a complete disgrace, Lucy. The NHS has 7.4 million people waiting for something. It is just a disgrace. And, I can predict what's going to happen. It's a political imperative to get that down for the current party in power. Whatever it would be, it's a political imperative. They want to show they've got the waiting list down. What's happened, the simplest way to get the waiting list down, because there's no coordination between the death certification and the waiting list, phone everybody up and see if they're alive or dead. And you'll get rid of 10% of your waiting list overnight just by making a few phone calls. I mean, you get some junior clerk to do the phoning around. And that's probably what we'll see happening. And so then there'll be a claim, we've got the waiting list down 10%. But of course, you haven't really. You've just taken off people that are no longer waiting because either they're dead or they've gone privately or they've gone abroad or whatever. And that's the problem we've got. It's become a political game, and it shouldn't be a political game. It's just a transaction, healthcare.
So you feel that the BMA is now a politicized organisation. They are playing politics rather than looking after the health of patients. That's how you see it, is it?
I really believe that, and I really think they're not really looking after the health and psychological welfare of their members, the doctors. I think the problem that the chairman of the BMA wanted to be a Labour MP and got turned down, that tells you everything about it. If he wants to be a Labour MP, go and be an MP. Don't run the BMA. I mean, it's astounding that we have this.
If
And
you,
so,
I
go
was going to say, if you were in charge of the negotiations right now, what would you do? What would you offer? I mean, it's come to sort of standoff, hasn't it? What's the
on.
compromise what compromise might break the deadlock, do you think?
Okay. What Wes has tried to do through his aides is introduce a whole set of very nebulous concepts that can't be quantified, that were a bureaucratic nightmare to implement, like paying back student loans. If you don't do that for medical students, what about teachers? They'll want their student loans paid back. What about people whose parents are funded? Do they get paid back rather than the student loan and so on, then pensions, take a bit of your pension now, we'll give you a bit of money so there's less pension contribution, so you won't get it later, but you can have the money now. These are bureaucratic nightmares. What the junior doctors need is to feel wanted. Sitting in very smart offices in London today, the spiders of the Australian headhunters. They're all there, New Zealand, Australian headhunters, sit in their offices, writing emails to people and hoping they'll come rather like flies into their offices, and they'll trap them and send them to Australia, where they'll get double the salary. But more importantly, they'll have a career structure that looks much better. Guaranteed consultant job in 5 years' time, no dealing with a whole lot of bureaucrats on the minor administrators on the way up, and a sort of feeling that they're part of the system, a wanted part of the system. Here, they just don't feel that. And I think if one could say and I think he's tried to do that, but the BMA won't have it. They want money. And he's tried to say, look, we'll look at all this, we'll look at everything, but I can't do it before Friday, so you've got to stop striking. But the BMA have advised them. The junior doctors the junior doctors committee is being advised by the older guys in the BMA that are pretty up for a war here, I can see, which is really very sad, because it's patients that will suffer, as I keep saying.
And so what would be your message to the government and to the striking doctors? What would you say to them?
I'd say think carefully before you strike. It's an evil thing to do if you really do it. The BMA is going to war with the NHS, but you won't feel good doing it. And if you win, in terms of the disaster you cause to the NHS, you'll feel even worse than you do. And money isn't everything. And in the end, a better career structure, which could be negotiated now, would be a better way forward than money just up front. That would be my thing. Go for a career structure that's doable, and a path to a consultant post which doesn't involve endless years in funny towns that you have no control on because you're not in charge of your own rotation system. So negotiate that. Forget so much that the money is not everything. And I think then everything will settle down. Like war, strikes come to an end, and always come to an end. It's how many casualties you've got to put up with on the way there. And it's not just the patients, the doctors will suffer emotionally about it. They'll feel torn. And the BMA are just ruthless.
Ruthless, yeah. I mean, they have said that, the student loans can be up to £100,000 for a junior doctor, hard to pay off if you're living in London. I mean, how does that ever happen? And you're saying that everyone's in the same boat, that it's just the way of the world. Why are they special? Is that what you're saying?
Exactly. I mean, Keir Starmer promised to abolish student fees. Where's that gone? Nowhere. Its student fees are still there. In fact, they've gone up. And so and of course, the real cost of going to university is the fact you're not working, so you're not being paid. And obviously, you have to live as well for those years when you're not being paid. And, I always admire people that have gone to night school to get into medicine, that really understand the very few people that have done that, but people that have actually gone to Birkbeck College in London, for example, done a BSc and then gone as a graduate to medical school, working whilst they're doing it, driving a mini cab or whatever, but doing something. And the very few, and they've mostly been very successful because they've done it the hard way. So, but the BMA is bad.
Well, you've spoken just lastly about alternative models of care, cancer care and NHS care, and just touch on some of those. I mean, obviously the BMA, the health system is almost beyond broken, and Wes Streeting's trying to introduce apps and digitize and more technology to try and fix it. But you've been critical of that. But what can you name some of the things? Would you
I think
promote 7-day working? What are the key things that you would do?
No political party will do what everybody's saying. We've got to come to some sort of social insurance system. Everybody's covered. You still get
very briefly. Yeah,
So
I know Yeah. Mm-hmm.
When everyone talks about our NHS, it's free at the point of care, which is fine, but it's overused, and it's a lot of people have paid nothing into it and are getting high quality care. It's not sustainable, just like the pension. The state pension is not sustainable as the population ages. There's not enough money coming into it. So we've got to put some sort of social insurance into it, but retain the universality. Can it be done? Of course. The whole of Europe works on that way. France, Germany,
Why
Switzerland,
does it make
Italy.
it better?
It
Why does
makes
it
it
help?
better because it lets people see the cost of doing anything. If you have a cut, now you can go to the pharmacist and he'll recommend little steri strips to put on it if it's not very deep. You put them on, you go home, costs you nothing, costs you the price of the steri strip, £5, baby. The alternative is go to the emergency room in Italy, where they'll charge you €150 for looking at it and doing the same thing. So people get quite used to the idea there's no need to overuse very expensive services. And I think that sort of thing, you've got to sort of make people understand everything costs in the NHS, and it's expensive, very expensive. And when you come to heart transplants and so on, and bone marrow transplant, we're talking some cancer treatments, we're talking hundreds of thousands of pounds. So having a social insurance system allows people to see the cost more effectively, especially for those that 80% of attendances at general practice are absolutely not necessary, but
So
we
this would
do
be a
them.
system where people pay in to an insurance system and then they top up. So
Exactly. And if
there's
you
a tension in the system, and it's becoming the money is you're paying for something as well. So it becomes not something
It
which is
dampens demand. And
yeah.
the way the NHS dampens demand by making it inaccessible. And the ridiculous business of phoning up at 8 o'clock to get a GP appointment. That's a great example of dampening demand. It's a pain in the neck. So only people that really need it or feel they really need it will do that. If you you charge £20, then you get the same effect. And I laugh at the NHS app at the moment. I've got it on my phone here. And it can tell me the number of my Pfizer vaccines for COVID and the date and everything, but it can't make me an appointment anywhere. And and it can tell me the pills I might want to take, and it can send me messages from my general practice about getting vaccinated because I'm an old man. They want to, and they get £30 for if I go and get my vaccine for a booster for COVID. I don't need that. It's gone, as far as I'm concerned. So it's all these things. And Streeting's right. We've got to digitize things. We've got to make it more like a budget airline, so you can get things on it just like a budget airline. I can book a ticket to anywhere in Europe now, and it's easy to do. The NHS app, as you know, is pretty clunky compared to a commercial app for some reason. I don't know why that is. But I think the most important thing is coming away from a tax-only based system to some sort of social insurance.
Yeah. Okay. Well, Professor Sikora, thank you so much for joining us. It's been really fascinating to talk to you. And let's follow this as it emerges if we can. Thank you.